welcome you all. It's an honor to have a hall filled of such healthcare dignitaries from the entire Tamil Nadu state. It is indeed a very special day where we have embarked our journey towards a healthier India strategy with Tamil Nadu as a state. And to brief you, this is our 8th roadshow in the series, and we have been doing such roadshows in many of the districts in entire India. And we are confident that as a result of this roadshow, there would be a huge milestones that we will achieve to keep the progress forward in the series of our MOUs or the dialogues that we are doing for each of the states in this entire roadshow. We are confident that the roadmap discussions will lay out a roadmap towards strengthening a state healthcare ecosystem. Moving forward to the agenda item, may I invite the honorable dignitaries on the dais. May I please request Mr. Gagan Singh Bedi, sir, IS Health Secretary, Tamil Nadu, to be on the dais. Ms. Preetha ma'am, Vice President, Apollo Hospitals and past President NATHEALTH. Ms. Anitha Niranjan, Director GHA, South Chapter Co-Chair of NATHEALTH. Mr. Siddharth Bhattacharya, NATHEALTH Secretary General. Mr. Shravan Subramanian, Advisor Premji Invest Private India Limited and immediate past President NATHEALTH. We have also Honorable Professor Dr. Muhammad Reela, Chairman and Director of Reela Hospitals. May I please invite him also to be on the dais. Oh, he's not yet here? Sure. So he's stuck in a different meeting, but he will be here with us soon. May I now request Ms. Anitha Niranjan to please provide the welcome address and initiate the discussions of this roadshow. Thank you.
Thank you, Anvesha. It's such a pleasure to be here today representing NATHEALTH. And I think this is such a lovely day here. And among the NATHEALTH roadshows that we have been doing, I think this has been quite a very good response, and we're very happy to see all of you here. For us, and especially for me personally, Tamil Nadu has always been in the forefront of healthcare and healthcare education. So I think it's very strategic for NATHEALTH to be here today and look at how we could take up strategies that could make impact in the healthcare industry. It's such a pleasure to have with us the dignitaries here, especially Mr. Gagan Singh Bedi, who is our Principal Secretary for Health, and he has been at the helm of affairs during COVID and has really stood up to the expectations we all had from the government when we were facing COVID issues in the country. And the commendable work here, as I'm sure he has many experiences to share with us, and that has been such a kind of applied for all of us. And I think that these learnings is what we would like to also at NATHEALTH take forward and see how we can work towards a better, healthier tomorrow. So, sir, a hearty welcome to you, and thank you for being with us today. And we look forward for very good deliberations with you and see how we can take our agenda and the members' agenda forward, and we look forward for very good interactions today with you. Further, I would like to invite Dr. Shravan. Dr. Shravan is actually, I think this is the first NATHEALTH meeting as being part of Azim Premji Foundation. I think most of us know him for being part of GE and supported NATHEALTH, and he's our immediate past president. And under his leadership, NATHEALTH has been very impactful, and he set us high standards for the future leadership to take it forward. A hearty welcome to you, Dr. Shravan. Miss Preetha Reddy, I'm sure I need not introduce her to most of you here because the leadership that Apollo has given all of us, I think all our dreams are around Apollo today. And we have her today is a great honor, and under her leadership, we seriously look at some serious impact that we can bring about in the healthcare industry. Madam Reddy, a hearty welcome to you. So we have Siddharth as well. Thank you and welcome, Siddharth. And the initiatives today, NatHealth is driving is actually being thought through, deliberated, many meetings happening, and then we are discussing what should be priorities for each roadshows that we are doing. And thorough follow-up by the NatHealth Secretariat has made this forum an excellent forum for all of us to take care our cooperative, collaborative agenda. So that's thanks to the NatHealth team out here, and a hearty welcome to you. We look forward to having all your ideas, thoughts, and make these deliberations extremely effective in days to come. Thank you for being here, and a hearty welcome to all of you.
Please request now Dr. Shravan, Advisor Premji Invest Private Limited, and our immediate past president of NatHealth, to share the context of this roadshow. Over to you, Shravan.
Good to see you and the NatHealth family. It's wonderful to be here. And really thank you all for showing up in such large numbers. First off, would love to thank our Health Secretary for not only gracing us with his presence, but being bang on time. We could set our watch by you. Thank you, sir. And we'll make sure that this is well worth your time. I know you have a very busy agenda. But our engagement with you and your team in the government is extremely valuable, and wonderful to welcome and see Preetha, our former president, and also the person who really envisioned the regional chapters that we have in NatHealth. If you will allow me one indulgence, while I represent NatHealth, which is a nationwide body, and I was the immediate past president, and all of India is very valuable and important to us at NatHealth. But I'm a Chennai boy, and I have a personal bias towards this city, and it's really a matter of pride to see a full house here, and look forward to a very engaging session. As a city, Chennai has been a pioneer in so many ways, and the South, Tamil Nadu has been a pioneer in so many ways. We have one of the oldest medical colleges in Asia. We have one of the earliest corporate hospitals that was founded here, centers of excellence, one of India's first private pathology labs, the finest diabetes specialties, the transplant centers of excellence, senior care, you name it, we have it here. We are really pushing the boundaries of healthcare from Chennai and from Tamil Nadu. And we have a lot of diversity here also across specialties. I think we have more healthcare specialties and segments within NatHealth membership here than there are varieties of dosa in the city. The complexity is also intense, right? We have manufacturing centers, we have R&D, we have skill building, we have expertise in public-private partnership, medical value traveling, you name it. Every sector, sub-sector of healthcare is represented in this region. And I think we have, as Chennai, we have a very, very important role to shape healthcare across the country, whether it's in policy, whether it's in investment. We have a lot of startups, and we have been engaging actively with various ministry officials as well as other industry bodies. You will soon be seeing quite a few documents that NatHealth has put up over the last few years, and particularly over the last several weeks with our engagement with various state governments. You see, when NatHealth was founded about 10 years ago, it was a small body of hospitals that were engaging with each other and with the government. Over the years, we engaged with several other trade bodies, and now in the last few years with several state governments. We'd had some high impact meetings across the country, north, south, east, west. We'll be hearing more about that. And each state, of course, has its own requirements, own infrastructural hurdles, if you will, and policy requirements and implementation challenges. So couple of things that I'm hoping to get out of today's session, both with the Chennai Roadshow and eventually we have the Governing Council meeting, is to see how we integrate a lot of these learnings from other states and strengthen our state here and take our conversation, have a dialogue with the government, with the ministry here, with each other to really move things forward. Specifically, over the last few weeks, we have some of our experts working on medical technology. Tamil Nadu has a very strong medical technology corridor, and we want to ensure that no dialogue is taken in isolation. So if we are taking the MedTech dialogue forward, it has to integrate with the overall thesis of healthcare across the state. And so we have providers here, we have medical technology experts here. The other point that we want to cover is around public-private partnership. There's been a tremendous amount of work that's been done across the country. Several states have highlighted the need and interest in public-private partnership, and Tamil Nadu, of course, has a leading edge there. So we'd like to drill down on that, see how we can all participate together, look at medical value travel, amongst other things. Our ask as NATHEALTH is for your engagement, right? Your inputs strengthen us, challenge each other, bring in more, membership. We want more passionate members that are part of the organization, that are driving the agenda. We are inclusive. We work, like I said earlier, with other federations as well. And so we welcome guests. We welcome different points of view. We welcome partner organizations. And I really, really look forward to a very engaging and exciting set of discussions today and beyond. Once again, thank you so much and welcome.
Thank you, Shravan, for such beautifully setting up the context. It has been really wonderful to work with Dr. Shravan Subramanian in his tenure. He was our President NATHEALTH. And we are so glad that two of our past presidents are here in this forum, Dr. Shravan Subramanian and Ms. Preetha Reddy. In fact, during Preetha Reddy's tenure and also in Dr. Shravan's tenure, NATHEALTH had achieved huge milestones. In fact, our membership base had increased a lot more during Preetha ma'am's tenure. So ma'am, thank you so much for all of that. May I now request Preetha ma'am to come up on the podium and give her keynote address. Of course, ma'am needs no introduction. She's the Executive Vice Chairperson of Apollo Hospitals Group, Asia's foremost integrated healthcare provider. She is widely recognized for her contributions in making high-quality healthcare accessible to millions and for her support to various entities and industry bodies in working for the betterment of India. We also... Over to you, ma'am. Thank you.
Namaste and really a warm welcome to everyone here. Special welcome to our Principal Secretary of Health and Family Welfare, Shri Gagan Singh. It's amazing that you took time off, and I've been sitting next to you and seeing the way your phone is ringing because you do handle an extremely vital sector, which is health. Thank you, sir, for taking the time and coming to be with us. And Shravan, Siddhartha, Anitha, I'm so happy to be here with all of you this morning. But more than anything else, I think, I value the time taken out by senior members from the hospital fraternity in the gathering. There's Prashant from MGM, Dr. Preetha Reddy, Ilan has come from Dr. Rela's, and I know Dr. Rela might drop in for a bit in the middle of all his surgeries, people from Kaveri, other hospitals and institutions. It'll be great to call out each one, but I know that all of you are here. And I think I value that time the most, because we haven't had a chance really as an integrated group in Tamil Nadu to come together and see what more we can do. And having said that, I must say that Tamil Nadu as such has always been on the forefront of medicine. We should be very proud of our state, even though, we come from Andhra. We have grown, started, done whatever we can from the state. So I think it's never enough what we can do for the state. And wherever we go, we speak at a fora all over the world, whether it's the WHO or any of those, we always use Tamil Nadu as a state and as a model. And I have to give the government credit for that, especially the officers and that team who are so passionate about what they do. Even the recent scheme, which is the Makkalai Thedi Marutvanam, is doing so well. They're taking healthcare to people's doorsteps. And again, that will become a model for others to emulate. Having said that, even the chief minister's schemes, it's close to us because we've worked with the chief ministers to bring it. And it took off in Tamil Nadu. I don't know how many of you who know that. Maybe, I've been around a long time. But having said that, it was in Tamil Nadu where all the systems, insurance companies coming in, and now it's taken off. After that, we have all the other schemes, including PMJ. But the fact is that, when the government really goes out and assures the public that we will take care of your health and, has a very systematic way of handling it, it happened here. So I think that's a great example. And the other thing I wanted to say is that the hospital, the Omandur Estate Hospital, started off as being an assembly. It's moved to one of the best hospitals in the country. They do the highest level of, transplant work. The ICUs are par excellence, and no one needs to hesitate and even think that, that we're going into a public system as against a choice of the private system, because they are doing such phenomenal work, which frankly, the rest of the world is looking at it. And I think it's a good time to flag it and say, sir, congratulations. We're so proud that the government of Tamil Nadu is doing so much. So a little bit of history on Nat Health. It was started 11 years ago, to be precise. And it was started by our Apollo chairman, my father. And it was started only because we did not have the right forum to bring all aspects of the healthcare providers into one table, into one room to talk about many of the things which, needed to be done. So we came together. It took a while. It, of course, took, some amount of seed funding from those who were passionate about this. And I have to thank all the founding team for doing that. But it has grown in membership, in stature. But more than anything else, to congratulate Siddhartha and their team, they really are a voice in the center wherever policy needs to be done and wherever, we have to do the right things for healthcare. I think the opinion of Nat Health now matters a lot. And that's why I'm delighted that, everyone who matters in the South is here in this room and, among this gathering, because it's really coming together of great minds, which helps us set policy, not only for right now, but for 15, 20 years ahead. And I think that's really what Nat Health's agenda is. They have been able to do a lot of things, including when, there were sometimes policies which would not let us function during the tough COVID times. But I think Nat Health had the courage to come together and be a voice and work with other organizations to do what needed to be done. And I must thank the team for the courage they had to steer us in the right direction. So having said that, I think, the future is exciting for Nat Health. We have started our regional chapters, which have become very vibrant. So I think we have we have 4 chapters now, which cover, each part of the country. We have a great membership. We have a vibrant governing council. And while I am in fact making a pitch for Nat Health for all of you who are not members to become members. But I think it's an exciting group and it's an exciting team. Please, be more engaged with us is what I would like to say. While we were talking, and that's why the presence of the health secretary is so important, we actually went around with the members and, spoke, and we said, okay, since the health secretary is coming, usually when we all meet, we have a list of requests. We say we want this and we want that and we want a whole bunch of things. So we were trying to make a list, and I was asked and said, okay, now what do we want from the government? You'll be surprised, sir, that we actually didn't have anything to ask. And this is probably one of the few governments in the country where private sector is just so happy being in this state that we don't have too many asks at all, and I think we must congratulate all of you for that. So having said that, NatHealth has gone to different states. They have traveled and met with a lot of, the health secretaries of states. We have signed up MOUs, and the MOUs basically is to see what can we do in the future. It's not really a bunch of asks, which can also be there if the sector has to flourish. But I think the MOUs are important because we have to think differently about how we deliver healthcare. And, one is, of course, can public-private partnerships, can that make a difference? We know there's a huge problem in skilling. So can we work together to skill more people for the future? Because every time, the other day also, Economic Times spoke about how the nursing, the people are just leaving and going overseas. So our country is suffering. So can we really do more in the skilling area? Allied healthcare workers, because we do have to provide jobs for people in our country. And can we do more in that space? Can we skill people in different aspects of healthcare? And that's where NatHealth is a huge and a valuable resource. Can we really focus on innovations? Because, we healthcare people have to have a AAA rating. And the AAA is affordable, it's accessible, and it's accountable healthcare. We have to think like that. So can we use innovation? Can we use, good startups to try and see how we can address this space? Can we work towards prevention of NCDs in a more clever, smarter fashion? Because we know that as many hospitals as we have, if the way and the NCDs are growing, our beds are going to be full anyways. But, can we keep people healthy? So I think that's another thought which we have to do. But more than anything else, India should become the hub for research. It should become the hub for innovation and research. And to do that, everybody has to come together because there is so much we can do to teach the rest of the world. Now we're the 5th largest economy in the world. And I think that is something every Indian has to be proud of. So why can't we heal the world? Why can't we do things for the rest of the world to emulate? We do it in pockets. There are islands of excellence. But I think as an ecosystem, we have to be the greatest and we have to be the best. So I'm so glad all of you have taken time off to be here. And sir, thank you again for your time. If we talk about healthcare, we can go on for a whole week. But having said that, there is just so much we can do. And I think in 10 years, we have reinforced our plans, our strategy. But going forward, there's a lot which you will see from NatHealth. Thank you and God bless.
Thank you so much, ma'am, for the words of wisdom. And thank you for pitching in for NatHealth. Thank you for re-emphasizing that we all have come together for the larger good of the entire ecosystem and our patients. I now move on to the next session for which we all have been waiting. But before that, as I stand here, I would like to thank and welcome a lot of dignitaries who have taken out time to join us for this roadshow. Thank you, Dr. Prashant Rajgopalan, sir, from MGM Hospitals for joining here. Dr. Ilian Kumar, CEO of Rela Hospitals. We are glad that you are here with us. Dr. Krishnamurthy, sir, CEO Meenakshi Hospitals. We have representatives of Kaveri Hospitals. Dr. Karthik from Atulya Senior Care, sir. Thank you for coming here. So I really welcome all of you. Mehta Hospitals. So welcome to you, sir. So now moving on to the next session, and we all have been waiting to hear our honorable chief guest, Mr. Gagan sir. He's the IS and the Health Secretary of Tamil Nadu. We all know him for his indeed good and great work that he had done during the COVID-19 phase and also during the tsunami phase. He's a senior IS officer from the 1993 batch. He's known for his contributions to ecology and the environment and has also won the Green Award twice and National Award in 2016. So very warm welcome to you, sir. Over to you to please deliver the special address.
Thank you. Let me start in Tamil first. Bedi இருக்கக்கூடிய NAT Health உடைய past president என்னை அழைப்புதல் கொடுக்கக்கூடிய முக்கிய காரணமாக இருக்கக்கூடிய Preetha Reddy அவர்களே, மிஸ்டர் சித்தார்த் பட்டாச்சாரியா அவர்களே, சென்னையோட சார்ந்தவர் தற்பொழுது பெங்களூரில் இன்வெஸ்டராக இருக்கக்கூடிய மிஸ்டர் ஷரவணன், டாக்டர் ஷரவணன் அவர்களே, திருமதி அனிதா அவர்களே, இங்கே வந்திருக்கின்ற பல்வேறு மருத்துவமனைகளுடைய நிர்வாகிகளே, மருத்துவர்களே, முதல்ல இந்த NAT ஹெல்த் சார்பாக இந்த ரோட் ஷோ ஒர்க் ஷாப்பில் கலந்து கொண்டுவதில் எனக்கு மிக மகிழ்ச்சியாக இருக்கின்றது. உங்கள் அனைவருக்கும் என்னுடைய அன்பான வணக்கத்தை தெரிவித்துக் கொள்கின்றேன். Actually, it's an important workshop. I just want to set the setting over here about what is the infrastructure that is there in Tamil Nadu and what we expect from the private sector for the government. This is my broad few minutes I will like to talk about it. Tamil Nadu is one of the forefront states in the healthcare sector. We are all very proud of this. எங்களுடைய ஸ்டேட்லே உங்கள் கான்ட்ரிபியூஷன் தவிர கவர்மெண்ட் சார்பாக ரொம்ப மிக முக்கியத்தை கொடுக்கப்பட்டு வருகின்றது. There are 36 medical colleges being run in the state, and whenever I go to the conferences in Delhi, we are very proud to say that Tamil Nadu has 36 governmental run medical colleges, which is perhaps one of the highest in the country. There are 37 government district headquarter hospitals. There are 256 hospitals, taluk hospitals, non-taluk hospitals. There are 62 hospitals attached to the governmental medical colleges. There are about 2,286 primary health centers, more than 8,713 sub-centers across the state. There are 2 super specialty hospitals also. We have got, Mrs. Reddy spoke about Omandra Hospital. எங்களுடைய Honorable Chief Minister சமீப காலத்தில் இன்னொரு சூப்பர் ஸ்பெஷாலிட்டி ஹாஸ்பிட்டல் கிட்டத்தட்ட கவர்மெண்ட் சார்பாக 500 கோடி ரூபாய்க்கு மேற்பட்ட இங்கே இன்வெஸ்ட்மெண்ட் பண்ணி கலைஞர் சூப்பர் ஸ்பெஷாலிட்டி ஹாஸ்பிட்டல் கிண்டியில் கூட தொடங்கியிருக்காங்க. ஸோ we are having a great infrastructure across the state. We are also a big family, the governmental system alone. The private sector, in fact, I should request NAT Health to give me the statistics. Mr. Bhattacharya was actually giving me some statistics before that. But there are over 19,000 doctors who are either super specialists, MBBS doctors who are serving the society of Tamil Nadu. More than 7.5 crores population is being served in the governmental sector by us. Every day, the governmental system alone is taking care of over 6.7 lakh OP patients per day. The number of inpatients per day is about 67,000 at any point of time in our governmental hospitals. More than 2,034 deliveries are being conducted in the governmental health setup system across Tamil Nadu. So we are having a big health network from the governmental system. But is it sufficient? No. The clap is only when the two hands are together, and one hand is the governmental hand, another hand is a private hand. If I am proud of a great hospital network across the state, I am equally proud of the private hospital network across our state who are doing a great service. Let me congratulate all of you for the great work that you are doing. Every day I get calls from my batchmates across various states across the country, many states in Northeast, West Bengal, Assam, other places, saying that their so-and-so minister is coming to so-and-so hospital for specialized treatment. They don't have that treatment in their states. You are giving that treatment. Many of those treatments our governmental system is also having. So you are, in fact, the private hospital network has made Tamil Nadu perhaps as the medical tourism destination of the world, not only in India. So let me congratulate all of you and again thank all of you, and also wishing from all of you that as the time goes, you will make us more and more proud of your achievements and in turn give help to the society. Over here, in today's discussion, though after this meeting I might leave, but I like a few thoughts which I want Nat Health to actually discuss. There are a few gaps which I feel that are there in our system. The first gap was mentioned by Preetha Reddy ji, and I will like to mention. The first gap I like to mention is in the NCD system, the non-communicable diseases. In fact, it was referred to by Preetha Reddy about the premier scheme of the governmental system, which is called Makkalai Thedi Maruthuvam. Nere per vandu last Sunday Hindule or one full page discussion. Idre English Tamil papers le kude Times of India has written also about the Tamil papers have written about the benefits of Makkalai Thedi Maruthuvam. What is that scheme? In that scheme, we are having across the state around 10,969 women health volunteers whom we asked to go every day house by house, check the BP, check the sugar level. We have given them the machines. For the women, they're all women, to guide about initial symptoms of the breast cancer or the cervical cancer. And then those suspected cases who are having either of these, BP, hypertension, cervical and breast cancer, to go to the nearest PHC for further treatment. Tamil Nadu actually is in the forefront. We have had more than our Honorable Health Minister a few months back, he had already told that our women health volunteers had covered nearly 1 crore population of around 7.5 crore. That's total, all including kids and all. So it had been covered a few months. It was started about 1.5 years back. We had covered, but covering and initially diagnosing the people with NCDs was done by us. But there is still a lot of gap. The STEP survey, which was conducted across Tamil Nadu, indicates that there is a possibility that 23% of the population might have hypertension. 7.1% of the population can have diabetes. 10.5% of the population can have both hypertension and diabetes. Now, through this Makkalai Thedi Maruthuvam, we have been able to diagnose so far 6.48% population having afresh, 6.48 out of 23%. There may be a few people who have not come into our fold. Let us say another 4 to 5%, but there's a large chunk of population whom the governmental system, though it's trying its best to diagnose, we have not been able to do so. That's where that's a gap which we like the private sector to also chip in. The hypertension, out of 7.1%, 3.83% has been diagnosed so far. The gap is there from our side. And both the people put together, as against expectation of diagnosing 10.5%, we have been able to identify and diagnose about 3.08% population. So there is a gap of about 7% who might have both of them, but the governmental system has not yet fully identified. And you know the complications, you know better than me. I'm only 2.5 months old into the health system, though I have acted as corporation commissioner, dealt with health at that point of time. But it's over here that for the NCDs, the governmental system alone will not suffice. The awareness amongst the society to diagnose for all the NCDs should be created by the private healthcare system also, through your own doctors network, through your field volunteers, through the public awareness system. We want you to help us in diagnosing that and bridging that gap and bringing everybody into the medical fold, so that the future society does not have further health complications. That is my first message to all of you. The second message is to help the society, help the governmental system in trauma and injuries. The trauma and injuries because of increasing road vehicles are increasing. Now it is over here that I will like to mention that we have, the Tamil Nadu government has started a unique scheme. We are very proud of it. It's not there perhaps in most of the other states. That is called In Uyir Kappom Tittam. In Uyir Kappom Tittatil, we have empaneled around 688 hospitals, out of which 451 hospitals are the private hospitals. The private hospital networks are there. The broad concept is, if there is any road accident and a person is injured, no questions asked, 108 ambulance or any other ambulance can bring them to these 688 hospitals across the entire state. Whether that person is having a health insurance card or not doesn't matter. For the first 48 hours, the patient will be treated free of cost by that hospital, and government will pay the hospital expenses for those 48 hours. After those 48 hours, if he is having a hospital insurance card or his own private, then that hospital can take over. But the first 48 hours is actually, ladies and gentlemen, we are very proud to say, though the number of accidents have been increasing, but the number of deaths, we have been comparing the last 2 to 3 years, has actually gone down slightly. It's about 1.5% only. We can also, I am not really tom-tomming it, because it might be also because of the road improvements being done, junction improvements being done by the state. But let us not be complacent of the fact that, okay, the number of fatalities has not increased. Because of this healthcare system, the people are bringing them to the hospitals, private hospitals, so they are taking care. In fact, last 1.5 to 2 years, we have paid the hospital system from our insurance 152 crore rupees for taking care of these patients who have been treated in the last 48 hours. So it is over here, my appeal is that those hospitals, many of you are actually empaneled in the health insurance scheme in Uyir Kappom Tittam, who are part of this. Please take good care of all the injuries, trauma care patients. Who are not part of it, please approach us. Try to get empaneled, because this is some service that you can do to all the injured persons across the state. Maybe Chennai may have, but my appeal is through you to go to the remote areas, especially along the highways. Those hospitals who are there in the private sector also, who are not empaneled, should get empaneled, so that we can treat our injured brothers and sisters more in a speedier manner and further help reduce the fatalities. This is my second message to you. The third message, which I'll just mention, is that we have not to be complacent about emerging and re-emerging infectious diseases. We are having COVID, we are having dengue, we are having Zika fever, etc. I am actually, every day I'm releasing the bulletin pertaining to COVID, and we have about, nowadays, yesterday I released nil cases. Day before yesterday, nil cases. Sometimes 2 cases, 1 cases, etc. But you are never sure about the viruses, etc. So during the COVID healthcare system, we actually felt very proud of all the efforts that you also took to it. While the governmental system went for the vaccine drive, the private hospital network also did a lot in this regard and helped us in not only delivering the vaccination system, but also giving your healthcare workers and also your doctors in all our camps, etc. So let us always be alert in ensuring that infectious diseases are taken care of in the future also. COVID is there, but it's the dengue season will actually come in another few months. We have to be careful for that, and we will request you also to spread the awareness amongst the society about preventing dengue. This is the third message. Fourth message is we should reduce the out-of-pocket expenditure of the society. Now, with out-of-pocket expenditure, I will like to mention over here, it was mentioned by Ms. Reddy, that Tamil Nadu has the healthcare system. We were one of the few pioneering states across the country which started in 2009 itself. That time the Kalainer Health Insurance Scheme system had started. 2018, our CM's Comprehensive Health Insurance Scheme was also onboarded along with the Government of India's Prime Minister's Jan Arogya scheme, PMJAY scheme. And both of them are combined now, and those who are socially economic poor are given the contribution from the Government of India's system and remaining to the Government of Tamil Nadu system. So totally we are having around 1.43 crore family beneficiaries who are part of the health insurance card system. The good thing about this is that every family who is having that card can get healthcare up to 5 lakh rupees per year. In fact, the governmental offices may not have, but a person who is having a card will have that healthcare system once in every year, 5 lakh rupees. What we are having about 1,822 hospitals enrolled in this, out of which 969 hospitals are in the private system. There are 1,513 procedures, 1,513 procedures for which we do the healthcare. And the Tamil Nadu's benefit is that whatever the governmental hospitals, because almost 50% of our healthcare insurance money goes to the governmental network, because our governmental network is good. 50% now goes to the private. Earlier it was higher for the private, but the government system has been catching up. In the governmental system, whatever all the income we get, a portion of that through a government order, we have earmarked for putting up for a special healthcare fund, so that all the surgeries which are over and above 5 lakh rupees, which are specialized surgeries, lung transplant or major transplants, etc., a poor person may not be able to afford that surgery. So such cases, especially in the governmental system, we are actually sanctioning on case-to-case basis from out of that corpus fund, so that a poor person should have the equal healthcare system, even if it's a costlier thing. And we always have buffer over there in this regard. So my message to you is, ladies and gentlemen, that healthcare system is becoming expensive day by day because of high technology and because of being better healthcare system. Two messages. One, I'll request other hospitals also to apply and be part of the healthcare insurance system, so that you are also able to help the people. Number two, those persons who are poor, whose annual income, though it is around 1.2 lakh rupees per annum, but it's like there are a large number of poor who are still, especially in the slums, etc., who still do not have the healthcare insurance cards. Through your network of officials, through the word of mouth, you can always put them on to us. You always have, the hospitals also always have a counter kiosk in the beginning about the healthcare insurance system. Through them also, you can actually mention the people to have insurance cards, so that more and more people, especially the poor, lower middle classes, are able to afford the healthcare system. The better, even the better healthcare system, even the government colleges or the private colleges. So we want you to join the government in improving the number of families who are in the ambit of this, and increasing the number of hospitals that take care of the healthcare system. This is something which I will like Nat Health also to discuss and give a message around, and the government is always there to be a part of this. In this last final clauses, the pre-authorization cases. Many of the patients, if they don't get the pre-authorization of the insurance in time, they will not be able to benefit from the insurance, even though the card is there. I'll request you to kindly review your insurance liaison officers in order to ensure that who are having the cards with them, do get their pre-authorization. They are made aware of getting the pre-authorization well in time, so that you also get compensated, and the patient in the process, the out-of-pocket expenditure of the patient does not really increase much. This is my fourth message to you. The fifth message is an important message. We have good state-of-the-art medical colleges. Ma'am mentioned about the Umamdrar Hospital. We are having Kalainer Super Specialty Hospital. We are having one of the best surgeons in the governmental system, etc. Medical colleges are good. There's a lot of focus of state government and the government of India in the basic root care, the primary health center and the health sub-centers also. We are actually upgrading the village level dispensaries in a big way, spending crores of rupees. Both the governments have actually been liberal in spending in the ground level dispensaries, etc. Perhaps now the focus, in fact, we had a meeting with our Honorable Health Minister and Chief Secretary, and we felt that now the focus needs to be given in governmental system on the middle level hospital, that is, which are the taluk hospitals, or not the district hospital, the taluk hospitals. It's the taluk hospitals, perhaps, which I will like to see in the future to be developed further in terms of better infrastructure, in terms of better staffing, etc. The government is doing making all its efforts to improve the taluk hospitals. Perhaps the message I will like to give to the Nat Health over here is that part of your CSR funding, perhaps you can have a hand-holding or adoption of some of the taluk hospitals also in the vicinity. A hospital which is in a remote area, which is not a PHC, which is not a medical college hospital, but which requires upgradation. Yes, perhaps adoption, hand-holding, taking part in schemes like Namuka Namitittam, upgrading the taluk hospital, because ultimately who will benefit? Our citizens will benefit. And it's here, that's where the government is also pushing. We will like you also to come and chip in, that you can come to us. Okay, sir, we will also like to handhold this hospital in terms of improvement of infrastructure, in terms of giving equipment, etc. Because yes, Tamil Nadu is spending a lot on its improvement in infrastructure. In fact, we, through the JICA funding, about 1,633 crores, we are actually spending on all the improvement of all the medical colleges. There are new towers, 2 towers coming up at Gill Park Hospital. There's new tower coming up in Madurai. The way you see the towers in Rajiv Gandhi Medical College, the similar towers are going to come up very shortly in Gill Park Medical College, in Madurai Medical College, in Coimbatore Medical College, etc. But what we are also, we are having so many things to do. It's in that middle level hospital. We like also you to come and participate along with them for their infrastructure improvement. 2-3 more points. The next is what we also perhaps need is your participation in order to digitalize all the sources of information. Tamil Nadu government is actually putting up, trying to bring on board the public health registry, wherein all the families are being registered, and so that given unique IDs, and it's in tune with the government of India's ABHA ID system, wherein any patient who comes will have a unique ID, or his family will have a unique ID, and all the ailments are once recorded in the server system, can be fetched on across other parts of the state if the same person goes with the same ID over there. So we are having, in Krishnagiri, we have almost done 60 to 70% of this registration. And based on that, in coordination with the state governmental officials and government of India, we are going to spread it across Tamil Nadu. So those hospitals who wish to share their best practices in terms of hospital information system, we will like you to kindly give your ideas. We'll welcome that. We'll put your teams with our IT teams in order to ensure that we learn here. In fact, the governmental system wishes to learn a lot in terms of hospital information system from all of you. And we want, because if you gain, we gain, then Tamil Nadu will gain, our citizens will benefit. That's with that thought, I feel that that's a little weaker link. We are still a lot into manual systems of recording, noting, etc. We will like the hospitals and we like Nat Health itself to come to give us their thoughts about it, about how to ensure that digitization of hospital records, we have the best of technologies, because this is something wherein if we put a lot of efforts and we have, after 1 year, we come to know, okay, private sector has a better technology, better systems in place. You can't really then undo the entire thing and do. So we are actually in the thinking process and in the beginning budding stage where you will like to take off. Perhaps your hand holding in this regard will be useful. The second last point which I will like to mention is the training. So see, the doctors are well trained. The doctors in governmental systems, though because of a lot of patients, etc., though they are well trained, it's perhaps the training of the latest technologies is something that we look forward to from the Nat Health. For example, the paramedical staff and the nurses, training of high-end machines, high-end procedures, etc. If Nat Health or the hospital network, private hospital network, feel that there is some procedures, systems, technology which are available in the governmental system, are still but are not being best utilized by the governmental network, you know about it. You can come forward, and we'll definitely like to benefit from the training that you can offer to the staff. In fact, I was recently in MGR University, I was seeing the latest technologies of training being displayed over there, etc. And many private hospitals were part of that latest technology of training, 3D based training, etc. Using those the software, you put this thing and you actually feel like operating the system. That I'm not able to recall the name of the technology. So we will like to coordinate along with the private healthcare network in training our paramedical staff, medical staff. And yes, for the doctors, whenever there are doctors' conferences of various departments, it's not there's a government doctors' conference. It's the conference of cardiologists, conference of gastroenterologists. Everybody comes in. That's an opportunity where we will like you to also share your best practices so that our entire health network system benefits. The last point I will like to leave a note over here is, of course, there we are the bigger stakeholders. The last point is about reducing our MMR and IMR ratio, maternal mortality ratio. Tamil Nadu is amongst the top 5 states in the country in terms of lower MMR, but still our MMR figures, which were tentatively around 54 per 1 lakh live births, is something we will like it to be 0 or in single digit. We have to come down further. We have been, in fact, as compared to all India figures, Tamil Nadu is much better. Just to give you a feel of this, because the governmental system or MMR system in the governmental system, all India figure is about 97. We are about 54, but we will like it to be a single digit figure. And similarly, infant mortality rate, it is 13 per 1,000 live births. That also we will like it to be below 3 to 4. So infant mortality rate. So though at the governmental system, we make a lot of efforts in reducing the MMR. In fact, last 2 months, I would have reviewed with the district, my chief secretary reviews the MMR, each and every maternal death across the districts. The reason for that is being reviewed by the district collectors, by my IAS officer, National Health Mission, by me, even by the chief secretary. That's the importance we give to the maternal deaths. IMR, the infant mortality rate ratio, the children's death are reviewed by us. But a lot of healthcare system, especially of the pregnant mothers and infants, lies in the hands of the private sector. We will like that the private health sector to actually guide the pregnant mothers who are coming to your fold to the broad basic thing. Since you are the captains of industry, perhaps the high-end procedures sometimes get better attention of the leaders. It is the basic thing of taking care of the maternal mothers, the infants, which perhaps will help also to reduce the maternal mortality, especially amongst those mortalities which are coming through the private sector. Ensuring that the food is taken properly, ensuring that the mothers are given the tetanus injection, ensuring that all the high-risk mothers which are having blood pressure or diabetes, etc., at that point of time are taken care of by your staff, are also brought into the governmental, at least monitoring network through Government of Tamil Nadu's PICME networks, etc., are taken care of. So if you also join with us, Tamil Nadu's vision of bringing it to both these figures to a single digit figure will be achieved. So these are all my thoughts which I thought I should share with you, so as to, because you are going to be here for next 2 to 3 hours, perhaps the discussion is there. And I'm so happy that I was invited over here by Ms. Preetha Reddy. Especially I should thank you, because through this conference I am able to share the thoughts of the government. And as I told you in the beginning, a sound clap will come only when both the hands work together. One hand is of the government, other hand is of the private sector. We will like the sound of Tamil Nadu's clap to be heard loud and sound by everybody across our country. With this, I would like to thank all of you for giving me this opportunity. Nandri, vanakkam.
Thank you so much, sir. And I also heard about 2 schemes. I'm not a Tamilian, but I thank you so much, sir, for highlighting the importance of Makkal Kai Tedi Maruthuam and Kalaikanar Kapitu Thittam. I hope I pronounced them correctly, but really, thank you. I would now hand over the mic to Siddhartha.
Thank you, sir, for this wonderful address. I know you will have to leave because of other pressing commitments, so I thought, in terms of some of the themes that you have covered, you talked broadly about health system strengthening. You talked about the system being more agile, more responsive when it comes to emergencies, being able to integrate the continuum of care from things that drive mortality, morbidity factors, which are kind of coming up. You talked at length about MMR, IMR. There are great, we'll deliberate on all of these points, but there are great centers of excellence across private sector spread around. There are points of expertise, great experts, clinicians, public health champions, and there are points of expertise available which we'll try to draw upon and come back to you with some concrete things we can do around this. Sir, you talked about the need for systemic capacity building, equity, and protecting the vulnerable, which is very, very important. You also talked about raising the quality bar and leveraging digital health expertise, to drive efficiency in the system. We all know that you cannot spend enough on healthcare. No country around the world has figured that problem out. And India has limited resources, and we have a lot of people whom we need to cater to that. You also talked about the need for us to leverage technology and make sure that we innovate when it comes to training at all levels, technical trainings, but also a theme that NatHealth is very, very engaged in now, which is leadership training in healthcare. And we believe that a lot of the issues, the nuts and bolts of healthcare, are also driven by the vision of the leader, particularly at the hospital level, at the department level, and the culture that they set in the organization sets the tone for many of these outcomes that you want to see. Sir, what we would like to do is, and NatHealth works on a whole lot of these topics, and we have created a small booklet or a set of publications. NatHealth has over 50 publications. We touched the number 50 about a few weeks back. But on some of these themes, based upon these sort of consultations, talking to some of the private sector experts, and as you can see, we have the ecosystem or the top leadership of healthcare who are connected to NatHealth. A lot of these viewpoints in terms of our positions are reflected in these documents, but what we'll do is, out of this consultation, come back with specific things from a Tamil Nadu lens that we can do, and we'll come back to you after in a few weeks from now once this consultation happens. One of the things as NatHealth Secretary General in the last 2 weeks, I have been in about 8 states with 8 principal secretaries: Bengal, Assam, Tripura, Arunachal Pradesh, Punjab, Andhra Pradesh. And Tamil Nadu is a leader. And I think you touched upon that point, particularly many principal secretaries call. And there is Tamil Nadu is a state that is leading. It plays a leadership role in setting trends. And we are very proud that, and you talked about looking at the entire health system as one, not as private and public. Ultimately, all of us are catering to patients, and we are all the cogs of the wheel on the patients are sitting in the compartments. And it doesn't matter whether that compartment is public and private, as long it reaches the destination soundly, safely, and on time. So from a private sector perspective, there are 2 things, I would request you, because Ms. Preetha talked about, we don't have specific issues here, but at an aggregate level in private healthcare system, the role of a state in such a leadership position can really help private sector. And it ties into a lot of the themes we have spoken about today. One is the issue of GST. And this is not a Tamil Nadu issue, it is a union of government issue, but Tamil Nadu is present in the GST Council and its voice matters in a big way. The issue with GST, all of us know in private sector, it also the same in public sector is, the healthcare as a whole is GST exempt. And right now, if I were to quote some numbers, a provider ultimately gets, the input, they don't get an input credit out of GST for everything that is flowing into the cost of the services. I don't think anybody has quantified it, but recently NatHealth, and we'll share that publication with you, we got almost 15 labs, 15 hospitals. It was a very hard, painful data to analyze. The quantum of the embedded credit that is not moving through the system to output is nearly 6% of the turnover. So it is something that is a cost of doing business in terms of the taxation. And whether the number is 6% or 3% and 2%, the idea of GST was to facilitate smooth transfer of credit through the system. And this has grown up by about 1.7% of the turnover of private sector, whether you were a provider, previously pre-GST versus post-GST, healthcare is the only sector where the embedded credit has gone up, and it's significant. And what is worrying is it is growing over time, which creates market distortions, which is against the goal of keeping healthcare affordable and efficient, like what we spoke. So it is something, sir, we would request Tamil Nadu's leadership, and we are happy to provide facts, figures, any questions on this. So the second very quick point, and this is a smaller one, it is something that can be solved. We are really trying to see how healthcare can be asset light. And asset light means learn from IT, learn from other parallel sectors. A lot of cost of healthcare. Some of the analysis we have shows us that as we think about viability cap for setting up a private hospital in a tier 2, tier 3 and other places, a lot of the upfront cost is really OPEX. So CAPEX is something that should be very, very asset light, which means it's important to keep vertical development, because land is so expensive, building is so expensive. It's important to keep the vertical sort of developments in mind. In many states, I also think it's true for Tamil Nadu, there is a restriction for the height to which patients can be treated. And this, limiting that or creating a ceiling will ultimately create hospitals to grow vertically, which means the cost of the assets are going to grow. So I'm putting it again in the spirit of Tamil Nadu being a leader. Whatever Tamil Nadu does, all other states will eventually follow. So it is something, these are two very small things we would like to put forward to you. We thank you for being here. The points you have made are very resounding points. It gives us, as private sector, to play a role in working with government towards universal health coverage. So thank you so far. We are very grateful to you for having spent this time.
Thank you so much, sir. We will continue our discussions. The next one is a really exciting session where it will be an open forum where we would like involvement and participation from all of you. But before that, let me mention a few of the dignitaries who have showed up. I would really be thankful, and I really welcome Mr. Manish Sardana from Polymed for showing up at this roadshow, Mr. Ravinder Dang for coming up, for joining us, Dr. Prakash from Star Health. We've also here Dr. Arun from Ashwarya Hospital. So warm welcome to all of you. It's really honored to have representatives from Helium, Metropolis, Medtronics, Indus Health Plus, and a lot of other organizations. So thank you for joining this roadshow and actively participating for this roadshow. The next session is actually an open forum where we would be talking about the priorities of the Tamil Nadu state, and we would need inputs from all of you and how can private sector engage and collaborate more. And for this discussion, I would now invite Dr. Rana Mehta, our partner in healthcare from PWC, to lead and facilitate the discussions. Over to you, sir.
The Principal Secretary Health give this. And, it actually reminded me of something, saying that, the future, William Gibson said the future is here. It's not evenly distributed. Just imagine if, we had Tamil Nadu healthcare globally. And I come from the north, and I know, how the public and private sector are very different. But I think it takes both the public and the private sector together to really make a difference. I think this next session, and we decided that we'll have an open session with everyone. And the whole idea is maybe just start with people's comments. What do they think should come in? There were some very relevant points which were raised regarding, maybe the GST, the way we go up vertically. But I think this whole area is, and I can see people, they're providers, they're payers, the people from single specialities, the people who are coming in from the diagnostic field, from the MedTech field. And we'll be recording all these points. So, if you feel there are points which, one, is going to catalyze the growth in Tamil Nadu, and secondly, it's also very relevant from a national perspective, please speak up. I think it's amongst all of them, I think I've moderated a lot of sessions, but this is going to be challenging because, everyone is there. So can we have a mic, and maybe what we could do is just raise your hand, and what you could do is just mention briefly who you are, and just I would rather say that just say a few points which are really relevant because we have a large audience here, and I'd like to give a lot of time to everyone. Maybe we can start with Dr. Prakash, obviously from a payer perspective. What are some of the areas you feel, as and we all spoke about, the provider and the payer being together. So what are those building blocks you think we should put in place today?
Dr. Rana, and thanks to NatHealth for this opportunity. Today, we all find that the common man, patient who is a policy holder is really not happy with the services. And every one of us will acknowledge that there are a lot of disconnect between hospitals and insurance companies. So insurance in India, there is a large gap in penetration, and penetration can happen, as we all know. Penetration can happen only through a positive word of mouth. But unfortunately, me being a doctor, like when I attend medical forum, I see that they forecast themselves as Rama and they point out to the other person as Ravana. And when I attend insurance forum, the same thing happens. But actually, there is no Rama or Ravana here. All of us are common man, and every one of us want a return on the investment and time. But this has to be well understood from both perspectives. I think NatHealth has got a great role to play here to achieve a common understanding. In fact, regulatory is also trying to come forward with a platform in the General Insurance Council, so that all hospitals today need not they are finding it very difficult to work with the insurance companies, because there are different insurance companies trying to have different guidelines. If there is a uniform guidelines created by all health insurance companies under the General Insurance Council, and if there is a common empanelment where there is no role for any intermediary, and if we arrive at a standardization of tariff based on the categorization of hospitals, and if we all agree that whoever is at fault will be willing to take the necessary disciplinary action based on the pattern of error identified, so that we self-regulate ourselves. And if there is any common advancements in medicine, for example, the health secretary was talking about robotics, or whatever modern advancements, some insurance policies or companies pay for it, some they deny, some they are paid off. Patient is in a worry. Patient says that the doctor recommends this for me, and why you are all telling, and none of this have been told to them when we sell policies. Unfortunately, there is an underwriting happening at the time of claim settlement. So all these things have to be addressed, and we have to take the help of insurance regulator and General Insurance Council. So I just want to submit this in this forum. This can help Tamil Nadu in a much bigger way, because Tamil Nadu has been leading in health insurance penetration as well. Over to you.
No, thank you. So I think, how do the provider and the payer work together so that it sets up for success? I'll just call out a few names, and then we can get maybe Karthik. One of the things where, again, I think going back to the, Tamil Nadu's again on senior care really happened to make an impact, right? While I think there are chains, there's significant impact. How do you see this ecosystem growing, and what should NatHealth help catalyze it with?
Thank you, Dr. Rana. Nice to be here among all of you. I think with regards to the senior care sector, I think Tamil Nadu is at the forefront. If you look at a national level, there are close to 20,000 beds in this space, and almost 70% comes from just Tamil Nadu itself, and we are at the forefront. The request to NatHealth would be is, emerging sector requires a lot more handholding than established sectors. It could be right from policy drafting to compliance, quality accreditation. It will be nice to have a bridge. A simple solution could be for emerging solution. In other industries, we've seen it as having a single window clearance for accelerating that space. I think there has to, it's a big ask, but facilitating such discussions to encourage emerging sectors to come would be great.
No, that's wonderful. Of course, Shravan is here and he's the veteran, but, I thought I'll not let Shravan go away because he was the past president. Shravan, as we go ahead, you have a lot of insight into what works and not, right? As NatHealth, you really catalyzed both the growth, but also, in a way, we got a place at the table with the government. So as we go ahead, what would your guidance be? How do we take areas, say especially like Karthik saying, senior care, home health care, it's going to become very different. But it's not regulated today. Tomorrow, if regulations come and they became so draconian, then it sort of chokes the system, right? We've seen also with IVF, some of the regulatory space, maybe actually a little bit of regulatory overreach, because from an evolutionary point of view, we've not reached there. So what would your advice be?
Yeah, I think, Rana, good point on the regulations bit. And, our health secretary was also talking about learning lessons from other industries. We heard speakers talking about, how do we learn from, say, the IT industry. And they were able to grow a lot without much regulation. And then, of course, you do need a certain amount of regulation to make sure that things don't go out of hand. The important thing here is to have dialogue. I think in the next session later, we'll be talking about, say, PCPNDT, which is a very important regulation from a safety and population standpoint. But then it can be considered restrictive when it comes to wide availability of ultrasound technology for hospitals and healthcare centers across the country. But we've opened up a dialogue. So NatHealth has opened up a dialogue with the central government, with the Ministry of Health, and we're talking to other state governments, and they are receptive. So I think that is the key here, is not to expect any miracles overnight, but at least to address the issues, open up the dialogue. We found the health secretary here in Tamil Nadu to be very open, and he's invited us actually to share more and discuss more and learn from him and share with him as well. So let's have that. Couple of specific points that I'd also sort of touched on earlier is in the medical technology space. How can we take advantage of the government's openness for innovation? We have a lot of colleges here. We have research centers. We have IIT. How can we look at utilizing the engineering capability and brain power that we have, marrying it with the medical capability and brain power that we have, and really putting Tamil Nadu forward when it comes to developing new products, manufacturing them. And we also spoke about skill building. So it's not enough if we have terrific products, but how do we ensure that there is last mile access to the products and how they're able to utilize them, integrate them into their routine workflow. Tamil Nadu has already been doing a good amount of work in public-private partnership. I was quite amazed to hear some of the statistics from the secretary. It's good to know that nearly half the empaneled hospitals are from the private sector, and apparently they are getting paid. They're getting paid on time. A lot of complex procedures, even transplants, are going to the private sector. So how do we, go broader and deeper in that and open up the coffers? The awkward conversation of pricing is certainly going to take place. We have experts from insurance here to guide us on reimbursement and how we can engage with the government and each other on that. So, thanks, Rana, for the opportunity.
Thanks. Manish, maybe, one of the areas, as we look at, healthcare growing, the whole idea of the MedTech and the consumable space. So what are some of the areas you think we can really catalyze? Because obviously, as accessibility grows, the affordability question comes in. Also, I think clearly now we're seeing that a lot of the Indian consumable and medtech players are becoming of scale and penetrating globally. So what are your ideas on that?
Thank you very much. Thank you, Rana, for asking me a very nice query. My name is Manish and I represent Polymedicure. We are one of the biggest producers and exporters of consumable, medtech consumables in India. We are the world's third largest IV cannula manufacturer. Now, I think from a NatHealth perspective, Rana, there are three things wherein you work with a health provider. So for MedTech is an enabler for a healthcare provider. Without MedTech, there is no warrior. So we are the arms and ammunitions for the warriors. Now, while NatHealth is looking at one, on demand increase, second, on the regulations or advocacy on the regulation. Third, another important aspect is the cost. When you look at the cost, there are two things, CAPEX and OPEX. While you can still get CAPEX funded, but OPEX is something which you need to generate on your own. So therein we come in as a MedTech. So that's where probably we look at NatHealth or maybe directly as a part of a dialogue. How can I help my providers, my healthcare warriors to deliver the same outcome, but in the process reduce the cost and probably serve more. So that's what I look at NatHealth for, and that's what we are looking at. Even globally, the traction which is happening globally is the same. Without compromising on the outcome to a patient, can I serve more? And to serve more, I need a reduced OPEX. How do I reduce the OPEX? And consumables have a major play in your cost of OPEX. While that's where second to HR. So that's where MedTech comes in. Globally, everybody is looking at us, and NatHealth has the best placed among all the bodies because you have providers, you have payers, you have MedTech, you have HIS, you have everybody as a part of the same ecosystem. So it's like a buffet. You don't need to order a la carte at various shops. So buffet is available, just order it to NatHealth. So thank you very much.
No, wonderful. And I hope everyone's got adequate enough to eat. Next, Ravinder, I see you there. One of the things I think the health secretary also said that, while they look at technology and ultimately, I think in healthcare in India, the technological access to care is important because both geographically we're limited, financially, we're not really going to be able to ever spend 20% of our GDP. So one of the requests he had, which was very pointed, was we don't want to go and put in some technology and come 3 years later and see the private sector as something very superior. So how can we really do a public-private partnership in this space?
No, thank you, Rana, for asking me this question. Just to introduce myself, my name is Ravinder Dang, and I represent THP. THP stands for Technology, Healthcare, and Big Data. So we are in that space. To answer your question, how can government invest in technology which stays relevant for a long period of time? Now, essentially, if you look at technology, I think what's critical is that the government needs to focus on what are the outcomes they are seeking out of technology. And it all starts with fundamentally aggregating data. At a hospital, you aggregate data through multiple systems. You aggregate data through the ERP system, through the HIS system, through the lab systems, through the pharmacy system. Now that data has to be aggregated into a single data lake, and that data lake can be qualified for economic parameters, for clinical parameters, for diagnostic parameters. It can be qualified, the data. And today there is enough tech available to make that work. So one assurance I want to give to the group here is that don't think your technology is redundant. I think what is important is how do you orchestrate the technology for the outcomes you need. And that's important. So you need to be clear about the use cases you're looking for. If, for example, in your hospital, you are looking at a use case of, let's say, serving higher number of OPD patients, and government did talk about serving a higher number of OP patients, then how do you make sure you engage the populations in that catchment to be able to make your technology work? So to me, I don't think the obsolescence of technology is that much of an issue. Orchestrating that technology requires clarity. And to me, there is enough talent and capability in India to be able to partner with the government. Just to give you an example of healthcare services, and I see Amit Mukim here, he's from IQVIA, but I can tell you other than IQVIA and a couple of other companies, the top 6 or 7 healthcare services, IT healthcare services companies in the world come from India. So there's enough available for us to go build. I'm very confident that as we go ahead, the changes which are coming in healthcare, which are triggered through digital, will be a catalyst to greater outcomes. But I'm available here if anybody wants to pick up this discussion with me. The second point, which probably did not get covered, and I want to just raise it and maybe get a reaction from you, Rana, now, is the aggregation of real-world evidence. A lot of our hospitals and diagnostic chains generate a lot of data in their catchments. Imagine a diagnostic chain sitting in South Tamil Nadu generating that data, a lab, of all the diagnoses they do in that place. What do they do with that data to make it relevant for the government to take the right policy decisions in that particular area? Because there could be unique data coming out of those that area which they want addressed, right? So I think the aggregation of real world evidence through a digital medium is probably one of the biggest use case governments can use to take the right policy decisions, take decisions around pricing, take decisions around how they want to orchestrate again their healthcare infrastructure. So those are a couple of thoughts from me, Rana. Thank you for asking me.
No, I think it's, while we are moving towards a superpower, I think one of the areas we really are a superpower is technology. And I can see really that if we use that, maybe healthcare could be the next one. And I think healthcare for a country has a lot of implications, right? Because I think it has a lot of soft power. Last month I was in the US and, I went to one of the large academic medical centers. It felt more like India because every doctor seemed to be of South Asian origin, including all my classmates. So one, you have the hard power, like China, where you go build roads, infrastructure. But I think we have a larger where I think we can use healthcare as a soft power, and that really changed the impression of the country globally. Right. Dr. Mehta?
Say hello. Sameer Mehta from Dr. Mehta's, but I'm more representing AHPI and CAHO here. I think two requests, which I think both NatHealth can play a key role is obviously in the payer-provider discussions. I think we clearly need to have many more of them. I think standardization was one thing you've already mentioned. Our view is copay is the only way forward because unless people take personal commitment of their own health payment, they are not going to make the system efficient or effective, because we'll have a lot of waste in the system without copay. And it seems that because of populist tendencies, we like this idea of let's not pass any amount to downstream to the consumer. And I think that's asking for trouble in the long term. That's one perspective that's very clear. I think the second one is we clearly need to do a lot more work together to understand cost studies. I think we've realized over time that healthcare inflation is much higher than normal inflation. I think when my team members come and ask me for salary increases, that's one. When equipment manufacturers, G is always kind, but not always. In terms of cost per procedure, it keeps going up. I think there needs to be some sort of collective dialogue around that to make sure that we don't kind of like become more expensive than what we deserve to be, because we've already seen structurally in, for example, IT, where India is no longer as competitive as many partner competitor nations for IT, for manufacturing in certain areas. I think that's a key risk. So the more dialogue we have so we don't structurally impair ourselves will matter. And the third serious conversation we have is at some point in the future, the world is going to continue to suck at a much faster rate and a much greater amount of talent that's available in India in scarce resources, whether it's in nursing, whether it's in technology around ultrasound and certain pockets like that. We need to have a little bit of those upfront dialogues so that maybe we make differential pathways rather than make a standardized nurse that graduates from an Indian college being completely international ready, because that's what they want to do. About 80% of the time when you ask them, is there a pathway we can give them where perhaps after serving a couple of years and maybe a decade or two in India, that they are 10x better for the rest of the world. And so therefore we've got now a pathway that they can earn across their lifetime a very strong collective, right? We do that in IT, we do that for master's program students before we send an IIT kid straight from undergrad outside at large numbers. That's a risk we see in the future. So these three requests we have: more dialogue, payer, more dialogue potentially with partners and equipment suppliers. I think the pharma premium now is becoming much more significant than a manpower premium. And just stronger dialogue with the government to understand that things like copay is the right answer rather than saying that no copay. Because if you and me don't take ownership for our health is going to stay where it is, poor. Whereas if we collectively take ownership, there's a higher likelihood we'll get something done. Thank you.
No, I think you brought out a lot of things. Who's responsible for the health? And I think that's the biggest what policymakers globally, is the government responsible for your health? Are your parents responsible? It's not true. Ultimately, you're responsible. And so I think those habits need to be obviously, and there's an advantage for someone who follows it. I think the second point which you brought up, and there's no dialogue in India, is regarding medical inflation. So the government is gradually moving from a provider to becoming a payer, right, over a period of time. It's already one of the largest payers. But, while it may not have been as effective as a provider, and I think maybe we leave out Tamil Nadu, but most states don't have a great track record. I think it also needs to ensure that it does not fail as a payer. And one of the components there is that we really need to have a transparent mechanism. Like you said, medical inflation is obviously 1 or 2% ahead of normal inflation. So can there be an index where, we are not talking about rates. Today, as a payer, I have no idea what the rates will be 5 years later. But at least we can link. As a provider, I don't know. So long-term contracts can't be entered into India because we don't know. So this whole mechanism and how do we build this? At least start the dialogue saying that I should be able to know what the government will give me in 2030, if I sign up today. And it shouldn't be the same amount. Right. Great. So I'll open it up. Sorry, the people who I could see, I asked them first, but that's just not fair on my part. So please just raise your hand and we can get the mic across. Yeah, please go ahead. I can see you.
So, we're from the diagnostics and imaging background. And one thing I think we can urge collectively to the various state and central governments is to do some costing studies about the most common diagnostic scans and procedures in the various imaging, in the various schemes. You talk about medical inflation, but sir, it's also true that it's some of the consulting companies that advise the governments on prices, and somehow they all believe that CGHS prices is very viable and it's the way forward. So I think if there could be some costing studies initiated and we collectively take some proposals and some studies to the government, and I believe Siddharth sir has already initiated some in the past. I think that would be a step forward. And of course, medical inflation, we all believe it's true, but if CGHS prices haven't been revised in last, I think 12, 15 years, I don't really know what to say. So I think we can take this collectively forward. And so please, I urge the consulting companies to at least consult the private practitioners, private hospitals before putting forth proposals about pricing to the government in the various public-private partnerships.
No, I think, Kabir, you brought out a great point. You put me on the spot by saying consulting companies. But let me actually give you a very good example of where we did an excellent costing and we took it to the chief secretary. It was through one of the organization. He said, excellent study, but this is what I can afford. So there was no point having the study done. The rates didn't change because, ultimately he said, this is the budget I have, right? I mean, you can come up with any figure. So that's why I'm saying that it has to be automatic. A sort of a mechanism has to be built. Today, if you have a government official, his DA is decided based on the inflation, right? It automatically keeps going up, right? So if you were to go up and say, why don't you, in 2014, CGHS rates, take your DA also on that rate, he's not going to be very happy. But when you take that same dialogue and the analogy, it doesn't work. But I think, Siddharth, if we all go together and say, this has to be done, like I said, if the government doesn't succeed well as a payer, it's going to be actually catastrophic for 500 million Indians. Because in a way, the money is the same. So you were being a provider. Now you moved a lot of that to become a payer. So obviously the provision of care is not that great. You don't have the same. The amount of money is not doubled, right, as provider and payer. So I think Kabir brought out a very important point. And, sometimes those rates also mean that people are just deprived of the second level of care, right? Because the hospital which can actually give you the correct diagnosis or the lab which can give you the correct diagnosis is no longer on the panel. So you'll have to live with a suboptimal diagnosis, which will enhance mortality and morbidity.
Around financing, I would like to bring out the senior care sector for sure and all the insurance providers and players out here. Of course, the star of the show is right here, Karthik, who has done immense work on the senior care side. But I think a lot needs to get done as yet, especially on the financing side. My question is to all the insurance providers and decision makers here. What is it that holds you back, especially when you spoke about copay? What is it that holds every insurance players back when they come up with a product to take care of senior citizens? And I'm not talking just acute care, I'm talking about subacute care. And what can we as service providers do to enable you to make some tough decisions to bring out those products?
Yeah, so I think very relevant, and I think we obviously will discuss this at a forum that, how do you, because I think insurance is very much on acute episodic care. It hasn't traditionally moved the whole component of, in fact, a couple of years ago, I did a consultancy for a global healthcare provider, and it was also a provider come payer entering India. And when we told them, they said, where's the insurance? You're just covering acute episodic care. But 90% of what happens outside the hospital. How do we cover that? So I think that's an emerging area going ahead. Yeah, I can see a hand there.
Yeah, hi. My name is Sri Kumar and I represent an organization called CareFinder. We essentially work again in the geriatric space. One very important area that I would definitely like NatHealth to take up is the area of mental health. As you're aware, it is a big catastrophe and it is already happening It's already diagnosed that 1 in 6 Indians has got some kind of a mental health issue. Private-public partnership, because I have visited various public health centers. While we did a great job in COVID, in terms of mental health, awareness, destigmatization, and access becomes a critical challenge. So these are probably something at a taluk level, which Sir had mentioned, is an area that Nat Health could definitely look at and recommend to the government.
Yeah, I think you're right. And again, we don't have a real mechanism. So one of the things of the pandemic was that it exposed a mental health epidemic, which was always there, but it wasn't there. But I think as the pandemic's gone, the focus on mental health has also really abated. And you would really struggle in India. And at one stage, again, as part of consulting, we were mapping the landscape. And it was unfortunate. We didn't find very many organized players. We didn't find a structure in place. And we need to look at how that viability of that sector comes in. How do you, like I think Karthik's worked and, looked at what really works in senior care. But what really works in mental health, because it's got so many shades of gray, people haven't been able to figure out.
Dr. Saravana Kumar, I represent Dr. Kumar's Healthcare. Actually, this medical industry, we are all private industry, we are looking for making profits to sustain our good services. But the public and the government as such, they are viewing us as a social industry. They are not happy if we make more money, I can say. To reduce the capex and operational cost, we can influence the government by the way of bringing down the land cost, like subsidized land, subsidized power and common facilities like pollution control facilities like that. We can even influence government for these health parks where government can give the land and expect us to participate in the services. There some percentages of our beds can be allocated to the government, and we can also benefit by the way of subsidies and the tax, etc. We can in that way.
I think that's a good idea, and which the government has done. I think the problem has been in the implementation, and there's been a lot of problems when one of the things, while you really don't have great examples of public-private partnership, while there are concessions, then the expectations from the government are also different. So, but that is clearly, if a government wants, just like they did for IT, they rolled out a red carpet, and it did happen in India.
My name is Dr. Alok. I represent Gleneagles Global Health City in Chennai. I have a fundamental request to Nat Health and other forums, AHPI, I know Dr. Samir Mehta as well. Let's look at the sustainability of private healthcare ecosystem in India. Everybody is trying to drive down the price while our cost is going up. So if you see the price increases that happen across the sector, I've worked in health insurance also for a few years, we can't expect more than 2 to 3% price increase every year, whereas inflation is about 7 to 8%. Our workforce wants to go to Canada, UK, they want to go to the Middle East, they get paid a lot better. We have to keep training fresh nurses, keep investing in that all the time. The doctors want a bigger share of the pie. I'm not blaming MedTech people, but consumption is a major hit on the P&L. All medical technology that comes to us is super expensive. So people talk robotics. Most people in the room may not know. A Da Vinci Xi is 24 crores, right? And the kind of compensation we get from the payers is not even covering the cost of the robot per procedure. So if you look at the industry, everybody is expecting fantastic healthcare at the price of a Ola or Uber. It's not going to happen, right? The Tamil Nadu CM scheme, I'm a big fan of the scheme, not criticizing. Cardiac bypass surgery is 95,000 rupees. That's a ridiculous price. CGHS, as the gentleman mentioned, the pricing was down in 2014. We were expecting 2017 revision, it has not happened. Copay, Dr. Samir Mehta mentioned, is a fantastic way to look at owning health. Because if you see a lot of these people who have corporate health insurance, even for cough and cold, they want to come to a tertiary care center, right? As an industry, I think we have to look at the sustainability of private healthcare. All said and done, when the COVID epidemic happened, was the country able to deliver healthcare without the private sector? No. Tell me one very big politician who wants to go to a government hospital for surgery. Mr. Gagan Singh mentioned he gets calls, ministers keep coming, they come to us as well from other countries. So while private healthcare is an essential part of the ecosystem, where is the initiatives for sustainability? Why is there GST on room rent above a certain amount? Are people there for a holiday? Not really, they're sick. Why there has to be GST on drugs in the OPD? We are not getting any credit. Why there is import duty for medical equipment coming from Germany and other countries? So these are some of my requests to NatHealth and other forums. That's all I would like to say. Thank you.
No, I think those are very important, and I think we've been crying out hoarse about those things. But if you need to take it to the next level, it becomes very important. And I think as the government becomes more of a payer, more and more people will come into the private sector. So it's not that the private sector is going to shrink anytime soon.
If I may address Sir's concerns, so let me put more insecurity in the room. From a MedTech perspective, I was a part of important discussions during the stent price control, which happened in 2017. So I happened to sit with a CFO of a big corporate hospital in Chennai. And we figured out, oh, yaar, what to do? Mera to niche ka profit suddenly shave off ho gaya. So what do I do? What do I do now? So when you go inside, we found, and it is true till today, when you look at your revenue, yet your bigger percentage of your revenue comes from MedTech. When you look at your cost percentage is more of HR cost. So I think if you need to go back and probably look at your P&Ls also. And it was happening during those times. So probably hospitals were more in selling a consumable than selling a service. Right?
Okay,
Whereas that's how the change is happening. Now it's going to be a near future. In the next session, we are going to talk about, government is talking about TMR, trade margin rationalization on MedTech. So whatever is the delta from your cost to at which you sell it to a patient is going to be limited. It's not going to be more than 30, 40, 50%, which today is, so that is going to further impact. So it's time to look at that. Second, robotics, yes. 3 years back, Intuitive was never in India. Da Vinci was selling in India through a partner, almost 20-25 robots. Look at today. India is one of the only selective countries worldwide where Intuitive has a direct presence. Just because all of us want to invest in something as a lighthouse technology, which you can go around and put hoardings around the city and say, okay, stitchless surgery or whatever, and try and do that. Right? That's where the MedTech comes in. You use it or you don't use it, but it's a lighthouse for you to attract patients. So on a MedTech perspective, that's where I'm talking about here. There are leakages around. My team and your teams are talking locally on MedTech discussions or negotiations, procurements, etc. But can we standardize it? Can we have a standardized discussion and with some trust, not as a vendor, but as a partner? Right? Can we standardize that? That's where I come in. I'm here. I'm happy to have that discussions. And trust me, our role is to empower you, to take care of your P&L. My P&L will happen on its own.
So I'll just like to make another point there. So one of the other problems that healthcare is going to have going forward, and I think somebody spoke about it, is working capital. So we had about 40% coming in from credit contracts, which pay in 60 days, 90 days, and the government thankfully pays in 6 months. So if we look at the structure of insurance penetration going up, more credit contracts, now 60% of business of large hospitals is credit business. Only 40% is cash. I'm all in favor of reducing out-of-pocket spending, fantastic. But if everyone pays in 60 days, how is the working capital going to work? Is there any preferential working capital funding available for healthcare? The answer is no. Are there preferential loans available? The answer is no. Is there any kind of relaxation in the fees for licensing? The answer is no. We pay the same commercial rates for electricity as if we are lighting up a shopping mall. We are treating patients. We need to run ventilators. So it's very nice theoretically from a consulting point to say, we will carry out your P&L. You know what? Our P&L is just two things. There are many healthcare people in the room. We actually have margins only on diagnostics and consumables. Room rents and all are absolutely not money making. We lose more money on the room than anything else. Just parking something for discussion. We can discuss over lunch. Ma'am.
No, I think very relevant point. That's why I think people are booking, hospital rooms in Ahmedabad, right, rather than hotels. So obviously, you hit the point absolutely right. It's at 5,500 rupees. Where can I get, food and service and also get my blood test done for free? So I think, we are really subsidizing things. I'm totally, thanks for that. Right. Anyone else?
Yeah. Hello, I'm Anitha Krishnaswamy. I'm very, very happy to see that everybody in this room shares the same fear that I'm actually sitting with. A lot of questions on pricing. I don't come from a medical fraternity, but I head a hospital as a CEO. But I came to this industry about a couple of years back, but looks like, hi Sam. Looks like we're not talking about diagnostics, we're talking about pharmacy, we're talking about everything. But I want to also say the consultants, the HR, thank you very much. That was the most expensive on the P&L. It would consume more than 70% of the top line, and it's really hurting to see that we are not able to cut that cost there. Talk about rooms, they want a 5-star room, even if they are sick. I'm astonished to see that healthcare is not is reaching a luxury industry at some level, and it's a necessity at the other spectrum. So there are no benchmarks like the other industry. I used to be in the IT and the mobility some years ago, but everything was benchmarked in those days. I'm happy that you're on the top 4. Please give us some benchmarks in terms of pricing, because we are lost everywhere. The inflation, every customer who walks in is even able to say that you're so expensive. Where do we draw the line to say, what is the correct pricing? A knee replacement in place in a hospital A versus hospital B is at least a couple of lakhs different. Why? It's the same knee. There are no benchmarks in this industry for us to refer to. It will be great if a study is being done. And thank you, Mr. Ravindran. Data is available and nobody is willing to share. There are technologies available to study from the business perspective, from the compliance perspective, from the growth perspective, from the quality perspective, but nobody is willing to share the data in a forum that external organizations are willing to help us grow. But I am surprised, why is there so much of secrecy in the data? It can be taken out without. Google is taking, sorry, I don't know if there are people from IT, Google is taking away all our data. AI is being done over all the data that we are sharing. But where this data has to be shared, and it's only for our benefit that this industry can grow as one unified force. And I think this is where I think practitioners have to come together to share data. Thank you.
No, I think very valid point, because I think the viability and sustainability as we go ahead needs to be looked at, because over a period of time you will not get more infrastructure unless we can really see that people feel it's viable. We work a lot with private equity, and a lot of private equity is coming into healthcare because they think it's attractive. It could go to any sector tomorrow if we don't deliver. Yeah, Ravind.
Yeah. So in my, because we work across hospitals, I really believe that there are a lot of revenue buckets which have not been streamlined or sweated out. And I think that, folks, if they share experiences, and NatHealth can be on that forum where people can share those experiences and realize that there is so much more, your individual asset can deliver for you. So for example, a lot of pharma companies are looking for real world evidence, and you can partner with pharma companies and create a real world evidence revenue stream in your hospitals or your diagnostic chain. That's a possibility. That's a real number. And it straight flows to the bottom line. I know, for example, I can tell you another use case. Our hospital have large amount of sales teams trying to, get referral doctors in their communities. And that can be a far more efficient process if you deploy technology in doing that. So that's another way of dealing with driving more efficiency within your asset. The third, for example, idea here is that while you have strong OP-IP conversions, but cross-sell to, for example, lab services or pharmacy or other services like physiotherapy, etc., are again a lot of possibilities out there. So to my answer to your question is yes, it's challenging, and I appreciate what you brought out, very provocative, but you hit the nail on the head. But there is a lot of revenue upside which is still available, and I think firms like PWC can bring those best practices to the community. We have a lot of experience, we can talk about it too, but NatHealth is the place where some of these learnings can be shared so that people can look at their businesses from a fresh point of view while they struggle with the challenges of pricing, payer issues, and they struggle with those working capital. Those are real issues on the ground, so I'm not brushing them off. But there is upside available, and I'm optimistic about that.
Yeah. And I think one of the things also the government through the ABDM program is trying to do is actually aggregate the data. I think the first area where they moved is in place of the labs, where they're asking the labs to share the data, which obviously gets anonymized. It also becomes very important for population health because we have no idea. You said Google knows where a flu occurs, the government doesn't know, right? So in a way, it becomes very important that there is a central repository, but obviously given all the data safeguards and over a period of time, that is also made available to the private sector so that it empowers them to better serve the communities in which they work. So that would be. I think we just have a couple of minutes, so maybe these could be the last two questions. Right, why don't you?
Good afternoon, one and all. This is Mohammed Saif. I represent Impact Guru. Impact Guru is an online healthcare financing platform where we help patients in raising funds for their causes. I believe everything was discussed, but crowdfunding got unnoticed. So I just wanted to highlight that crowdfunding has been playing a very important role in past 5-6 years. And we have been working very closely with Apollo, MGM, Kaveri, Rela, KKCTH, Global Hospital, and all the major hospitals in Chennai and Pan India as well. Like if I request NatHealth to again help us in giving more visibility to crowdfunding amongst the people, it will help us in getting close to a more number of patients where we are helping hospitals and retaining the patients in the hospital, and it can be in any kind of surgery, any kind of treatment, and also rare diseases as well. I believe even rare disease was not discussed till now. So we have worked and helped a lot of rare disease patients suffering from SMA type 1, type 2, Gaucher disease, Pompe disease, etc. So we have been there, and we want to explore more, and we want to help make healthcare more affordable for all the patients across India.
No, I think that's an excellent point. So I think sometimes the providers get very caught in just the clinical provision of care. But I think the financial access is what catalyzes this because there's no accessibility without affordability. So if you want to grow this ecosystem, and I and Karthik were talking, especially in senior care, it's not only about the healthcare and the care component, but you need to build that ecosystem from a financial, from a knowledge point of view, so that you are effective. I think that was a very important point you brought up.
Thank you, sir.
Health and nutrition, WASH, wellness, vertical of IP Global. So I would like to share a few public health perspective as well. So we can see at the national and the state level, we are going with One Health, multi-disease elimination, etc. with a special focus on TB elimination. There are some self-sustainable models which are being promoted by the government, and also there are certain incentives which is available for the private providers from the government side, and moving towards the personalized healthcare, home healthcare, geriatrics, etc. The second point is embracing technology like artificial intelligence, which many of our hospitals are already doing with the blended and impact financing model. So IP is also helping hospitals and private providers for streamlining the operations with some of the organizations with a funded model. And we also have to look at a climate and disaster resilient health system and preparedness, and prepare for the trends of the diseases. And a consortium of private providers sharing the inputs and the support required during the district level health meeting with the district collector would also help.
Thank you.
No, thank you. And so I think one is to see what we are doing today. But, I was at a global conference where, somebody brought up that if, healthcare were a country on its own, it'll be the fifth largest country contributing to climate change. And that got us thinking, right? Because we are never thinking of us as someone who contribute to climate change, but healthcare is right up there. So I think very proactively to look at some of those areas, how do we make a change before even the government realizes, and make sure that, because like we are saying that you've given us a license, but here we coming back and actually having a social license to operate. Ma'am, you would like, Dr. Prakash, can you give us?
On the ESG, I think it's a very good point, and all of us have to get together to do it. There's some simple steps which hospitals can do, and I suggest that NatHealth, it's not very hard to bring out an ESG manual, which we will just share with everyone. And things like usage of plastics, biodegradable stuff is available. And sometimes when it's not, how do we, handle the disposing? So I think responsible healthcare providers is a great thing to do. And I know that globally with the WHO and the World Economic Forum is really focusing on it, especially with the healthcare providers. So thank you for that, almost like being the last word, but very important for our planet. I'll tell you what we did, and it was also with the Rotary Club, is that it was to thank the doctors on Doctors' Day 2 years ago, because we went through so much of trauma with COVID. So we planted 100,000 trees throughout the country, but then we worked with Rotary, and they also did like an equal number. So actually, if one small institution can do 200,000 trees, if together, things like that can happen. So I just wanted to put that thought also to the whole group here. Thank you.
I think a wonderful way to say how can we contribute back to society. And like ma'am, you said, these guidelines are simple, but most hospitals are not aware. So it'd be great if NatHealth can actually put in, because at least we have the direction where we're moving. Right. I think we more or less come to the end. Dr. Prakash, maybe the last words from you, and then we can conclude.
Maybe as a part of a solution to what we have been discussing, I could hear a lot of very critical and sensitive points. Majority of them are talking about what is a standard cost, what is appropriate cost, how to arrive at the cost, be it for an imaging center or a hospital or for an insurer. That is where is a drawback today. And I have a news. There are some 32 plus health insurance companies. Majority of them today are not making profit because they again blame, because they don't have an appropriate cost with the providers. So in this context, probably the General Insurance Council, which is the body representing all the member insurance companies, we are planning to do a study with PWC. A study on how we can categorize hospitals and identify some elective procedures and find a tariff for these procedures based on the category of the hospital. So once this comes in, I'm trying to be part of a solution. The next 6 months, we should have some light into this area. And majority of us, we are talking about how we can standardize the cost. So health insurance companies have a huge data. People are talking about how we can conglomerate the data. And we can see that what are these identified commonly done elective procedures and what is the cost currently being paid, what is being charged and what is being honored by the insurers, and what can be the appropriate cost. So we can do a study, we can come with that observation. Probably with NatHealth, we can create a roundtable, we can discuss, we can fine tune it, and we can make it very practical and implement it in the days to come. Thank you.
Thank you. So I think we could have gone on and on, but this was really nice. Firstly, I appreciate everyone taking their time out coming in. I think it was very inspiring to actually hear the Principal Secretary. Very inspiring to say how Tamil Nadu has worked. Also, I think it was really important that, and I know Anvesha's made note of all the points we brought out. Look at what are the areas, because ultimately, we as a sector need to work for ourselves. You've seen the other sectors and they've grown because they've made sure that the policies have been reflective of what catalyzes their growth. And maybe through NatHealth as a forum, we are planning to do the same. And finally, I'll thank Ms. Preetha, because I think the whole idea of ESG, it strikes a very good chord, both with the community as well as the government about how do we, as we grow, we are more responsible and we make sure that we leave this earth a better place than where we inherited it. And finally, thank you all for being a wonderful audience. Take care.
Anna, for moderating the session, and thank you all of you for being such a wonderful audience and making this such a participative session. And we have taken notes from the inputs that we have received. So many points have been covered. There's a lots of work that needs to be done, and we will get back to you. This is, as we have come at the end of the session, we have to, I have to formally give vote of thanks to you. It's really an honor to stand here in front of you and, sort of moderate and, hear from all of you. It's wonderful. Thank you for taking out the time and showing up for this roadshow and making this a huge success. To start with, let me just thank our honorable chief guest, Mr. Gagan Deep Singh Bedi, Health Secretary, Tamil Nadu, for his gracious presence. Ms. Preetha Reddy, our past president, Dr. Shravan Subramanian, our past president, for giving their insights and, always guiding us. Ms. Anitha Niranjan, our co-chair, South Chapter. Dr. Hari Prasad from Apollo Hospitals, who's always been very supportive. Dr. Rana Mehta, who's always there with us. And my special thanks to the entire Apollo team who have been working with us day in and day out. They have been wonderful support and are involved day in and day out for the success of this roadshow. My special thanks to Ms. Shailaja, Dr. Naveen, Mr. Jairam, Lata, and Sylvia, and Suganti from the Apollo team. I would also like to acknowledge our past presidents, the entire GC members who've showed up, the NATHEALTH members for joining, and the media who have showed up for this roadshow. I'd also like to mention few names, and I'm really sorry if I missed some of the names for their representation here. My special thanks to Kaveri Hospitals, Atulya, Senior Care, Metropolis, Polymed, MGM, Rela Hospitals, Meenakshi Hospitals, Aishwarya Hospitals, Star Health, and many more who have joined us today. I also want to thank my sponsors, without whose support we would not have been able to make this event successful. My special thanks to Apollo Hospital, our gold sponsor, Impact Guru, Agilis Diagnostics, and Marengo Asia for their support. Our silver sponsors, thank you again, Polymed, Metropolis, MGM Healthcare, Atulya Senior Care, Indus Health Plus, and Wokhart Lifelines. The bronze sponsor, Healthium and AMRI Hospitals. Last but not the least, our special thanks to AHPI representatives who have joined us for this forum. Really appreciate all of you. Please join us for the lunch, and a special request to our NATHEALTH members and the Governing Council members to stay up for the Governing Council meeting that starts at 2. So, thank you. You've been a wonderful audience. We all please assemble on this part of this conference room. We need to have a group picture. And I'm requesting my colleague Pushpa and Brinda to please assemble the people.